doing today?
Good, are you?
Good. My name is Caitlin Getchell. I'm a student physical therapist at the University of St. Augustine. Before we begin today, can you please confirm your name and date of birth?
Charlie Cleto, 0219-1993.
Great, and can I check your bracelet?
Sure.
Thank you. So, do you know where you are today?
Yes, I'm in the clinic.
Perfect. So, I understand you've come in today with facet impingement, so some neck pain, is that right?
Yep.
Okay. So what I'd like to do is what we have called cervical traction, and what this does is it's basically going to lengthen and kind of separate the bones in your spine, the vertebral bodies,
Okay.
and this is going to therefore decrease your pain and allow more opening for like structures to not be so pinched up.
Okay.
And then the second thing it's going to do if you have any sort of muscle spasms is it's going to stimulate what's called the Golgi tendon organ, and this is going to help relax the muscles in your neck.
Okay.
So does that sound like something you'd be interested in?
Absolutely.
So before we begin, I need to make sure you don't have any contraindications, and those are things that if you have, we can't do this.
Okay.
So do you have history of any malignancies or cancer, osteoporosis, ankylosing spondylitis,
Nope.
rheumatoid arthritis, any spinal surgeries that we should be aware of,
Nope.
or any long-term use of steroids?
Nope.
Okay, and then so precautions, are you claustrophobic?
No.
And do you have chronic obstructive pulmonary disease?
No, I don't.
All right, so you seem to be a good fit. Before we begin, on a scale of 0 to 10, 0 being zero pain at all, and 10 being you have to go to the emergency room, how much pain do you have right now?
I would say I'm at a 6.
A 6? Okay, so would you like to get started?
Sure.
So you can stay there. I'm going to go ahead and do a skin inspection on your neck just to make sure everything's okay.
Okay.
All right, everything looks good. No wounds or rashes, so you can go ahead and hop up on the table.
Okay.
So you can take your shoes off.
Sure.
And I'm going to help you rest your head down where it's supposed to be.
Okay.
So go ahead and come back. All right, scoot down a bit. All right, go ahead, relax. Okay, so basically, I'm going to go ahead and support your feet up here. That way you're nice and comfortable. So can you lift up for me?
Sure.
Relax. How does that feel?
Good.
Good. So this strap is basically going to come around your head and it's going to hold your head in place, and then I'm going to go ahead and tighten these. When these are tightened, you really shouldn't be able to talk, so if I give you any questions, you can give me a thumbs up if everything's okay, thumbs down if not okay, and then in the middle if okay? And then also once we get started, I'm going to hand you this, and this is basically a stop button. So if at any point during the treatment you want this to stop and I'm not near you or you can't speak, you can go ahead and press this and it's going to stop the treatment.
Okay.
I'm also going to leave you this ball belt. And if at any point you feel uncomfortable or you can't get that to stop, you can go ahead and ring this and I'll come here and help you. Does that all sound okay?
Sure.
All right, so I'm going to go ahead and fasten this around your forehead. Is that nice and snug?
Mm-hmm.
Okay, and then I'm going to go ahead and start tightening these. Let me know when it feels kind of tight, but not too tight. It's good? Great. So I have these parameters set up. We're going to do, first I have this inclined at a 10 to 15 degrees because it's at the C3, C4 level. Next I'm going to set my parameters to intermittent all across. You weigh 190 pounds, so I'm going to take 7% of your body weight, and that's going to be the amount of pull. That math comes out to 13.3 pounds, so we're going to go ahead and do 13. And then I'm going to have you on a 1-to-1 on-off ratio, and that's just basically the machine's going to do its own thing, and we'll go from there. And the treatment duration should last about 15 minutes. So give me a thumbs up if that sounds good. I'm going to hand you this. I'm going to attach the rope to you, and then I'm going to go ahead and start it, okay? So I'm going to go ahead and start it. And if you need anything, go ahead and press that button or ring the bell, and I'll be back in a couple minutes, okay? All right, so it's been 15 minutes. How does that feel? Good, so I'm going to go ahead and release the rope for you. So what I want you to do right now is go ahead and lay flat for about 4 to 5 minutes because I want to make sure that you're not feeling any dizziness or unsteadiness as you get up.
Okay.
Before we end this, back to that pain scale I told you in the beginning, 0 to 10, 10 being the worst pain, you gotta go to the emergency room. How's your pain doing right now?
It's at about a 3.
A 3, okay. And then are you feeling okay to sit up?
I think so.
Alright, so I'll come and help you up. And let me just do a skin inspection real quick. Everything looks great. So the way we'll finish off is with a couple chin tuck exercises. Does that sound okay with you?
Sounds good.
Perfect.